Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio on this cold and in Kansas City slightly gloomy Monday morning. But remember, 2021, 2022 starts right now. Go Chiefs. Hey, speaking of the Super Bowl, it's time for getting back to spring sports, and we have a sports medicine expert with us, Dr. David Smith. You may remember David. He has been with us before. He's our medical director of youth sports medicine. We're going to be talking with him not about Chiefs, although I could still hear sitting there. We'd be talking about Chiefs in the morning before we got here. But now we're actually talking about fall youth sports and the safety of it in this pandemic. But first, Nathan Barr sitting in for Doc Hawk. How we do over the weekend, Nate?
Well, you know, the numbers are continuing to go down.
They're good.
Yeah.
We're excited.
We're at 27 active infections right now in the hospital, 10 of those needing ICU care, 5 of those on the ventilator, 52 in their recovery phase, so 79 total. So that's down quite a bit from Friday.
We like it.
Yeah, so that's, you know, good news overall. Obviously still really sick people though, 3 deaths over the weekend, for instance. So, you know, still people that are here really sick, but the overall trend is good in terms of numbers.
They are. How about out at Hays? How are we doing there?
Hays has 21 inpatients, 10 of those are active.
Okay, they're still up though. They're still, but 10 is a lot better. They had 20, 24 actives for a while, or even higher. So this really represents a significant drop for us. We haven't been in the 20s. I saw that happen over the weekend. Like Friday we were at 30. Saturday we were at 30. I'm like, oh, come on, please, let's get under 30. Let's get under 30. And then Sunday 28, today 27. So we are really, this is a good trend, folks. We like the trend. Keep up the great work. I know we had a lot of Super Bowl parties, maybe not as much to party about as we'd hoped, but nevertheless, still a great season, and we want it to continue to be a great season with this COVID pandemic. Watching those numbers fall, watching vaccinations rise, that's pretty exciting. Okay, before we jump into our discussion, are there any reporter questions this morning? Okay, let's talk to Dr. David Smith. It's been nearly a full year of playing sports throughout this pandemic, David. What are your biggest lessons we've learned so far?
You know, it's neat, Steve, to look back and see the lessons have definitely been learned. And one of the big things is that we said that we could get started, and we did.
We did.
And we kept going. Yes, we had a number of events canceled. In fact, with our contracted schools that we work with, we figured a little over 400 events were canceled or at least delayed because of the delay of the fall season and the delay of the winter season too. But here's some really cool lessons. Number one, we did learn that outdoor sports are a little safer than indoor sports, that the contact sports are a little bit greater risk than non-contact. That seems kind of a no-brainer there. But one of the neat things too is we realized that the rate of COVID infection in the community plays a big role. That if it's high, we're going to have more, obviously, contacts with sports. But we also learned that masks can mitigate that in indoor sports. There's some neat data that's coming out with that that's not published yet, but it's been looked at and will probably be published in the next few months. And the last thing is that we still know that the infection is not on the field in training and in competition. It's in their social circles. That's been made very clear, that it's equivocal on the field and in the community. And therefore, we need to keep being careful with athletes and keep them out of these social circles. And the NFL proved that. The MLB proved that. Professional, everything. NBA, that soccer, you got to keep these athletes, they got to be careful and use those pillars of infection control.
Yeah, because you would have thought that of all the sports, football, wrestling are two of the toughest, but it looks like we actually got through the NFL season. But no, they did a lot of testing, in fairness.
Yeah, well, that's true. With the pros, we get to test and monitor them very carefully, but I was surprised with wrestling. We're coming up to regionals this weekend in the state of Kansas, and then we'll have state in a couple weeks. I've been surprised. I mean, it just has not been the rate of infectivity that we thought it would be. Yes, they've had to shut down some teams because they get a contact within the team, and of course, tracing says you got to then quarantine, but overall we've been very pleased. Now the participation rate in youth sports is down. I think that probably helped. I think that there's some parents and athletes that chose not to participate this year, no different than in the pros. We could have used an offensive lineman maybe yesterday with LDT, but you know what? That's their choice. But it's neat to see the sports are going and the athletes love it. They're so happy to be out there doing something.
Yeah. I think that's probably true. Talk to us a little bit about how the whole high school sports thing played out. Did we have to cancel season still, or did basketball's gone? Are we going to play
Yeah.
baseball? Where are we?
So I'm on that sports medicine advisory committee
You bet.
for the Kansas State High School Athletic Association, and I'll tell you, a lot of work was put in through Acacia to try to figure out how to get sports going and how to keep them going. Yes, they had to delay the start of the season in the fall. They delayed a little bit in the winter, and they kept spectators out of the stands, but they've chosen now to slowly increase that as we're seeing the community spread go down. Yet they're going to keep them in bubbles up in the stands. I think that recently they just passed through the board of directors with Acacia that they could have more spectators per participant on the court, but they're going to still have masks on, bubbles, infection pillars of control. So, you know, it's neat to see. Obviously, there was some angst in that, and if you look across the state of Kansas, there's some communities that were up in arms over not being able to get into the gym and watch their kids play. They didn't want to wear masks and so forth, but as long as we kept the pressure on that this is what we have to do in order to participate, then we got a little better buy-in from people. And it's carrying on into the spring. In fact, I was on a Zoom meeting last week on what we're going to do with spring sports. You know, we've got track and we've got soccer, we've got golf and other sports going on. So we now have the same types of things that we'll roll out with spring sports.
Yeah, and it looks like that should be safe because it looks like we've done a pretty good job.
Well,
so
and that's
far.
it's an outdoor, most of them are outdoor. Obviously,
Yeah.
bowling is indoor. We don't worry quite as much about bowling, but
Right.
it's a sport, so yeah.
Yeah.
And other activities, you know, we can't forget debate and other things that these students do. They're so important to their health.
And the
their
culture,
emotional
yeah,
health.
because I think it's become pretty clear that the not being in school is having a pretty profound effect on kids.
Yes, that's very clear in the patients that I see that are student athletes and talking with their parents. It's been devastating to them. And I tell you, these kids, it's kind of neat to see in the office too when I see student athletes as patients. They're wearing their masks up over their nose. They're being careful, and I thank them. You know, I say, go back and do this when you're back out there participating so we can keep sports going.
Yeah.
You've got to buy in.
Yeah, and I think we've also proven that we can run schools pretty safely.
Well,
You know, they're
that's another.
dedensified, they aren't as crowded, but in that situation, with good masking, kind of looks like it works.
Yeah, yes, and that's exactly what we're trying to stress. Even in track. Track is a sport, you know, we got boys and girls competing at the same time. It's in a big outdoor venue, but, you know, they like to congregate. They like to socialize. They like to eat snacks together. And we're telling them, you just got to keep being careful about that. And that's what I observed with fall sports, out of covering some of the high school football venues, where you'd see some of the athletes were very good about being careful. Some were not. Some coaches were. Some were not. You know, when you watch someone eating a candy bar while they're handing out water to athletes, you say, no, that's not a good idea. Let's make sure we wash hands and be careful. We
Yeah.
can keep doing this.
You bet. So Nate, do you think the variant's going to change that story?
Well, the same principles would hold, I guess, is how I would think of it, right? So it's going to just emphasize, you know, those important interactions. They have to be masked. You know, you can't have any chances. So, you know, that's really how I think of it. Is hopefully the safety can stay there, but you got to continue to mask, continue to, you know, be apart from each other when you can. Just limit the spread the best you can, and as long as you keep that up, we should have a good chance of, even with the variants, of doing it safely. But has to be emphasized, and as you said, the buy-in is so important. If we sort of let our guard down and say, well, you know, I just heard on KU's broadcast today, numbers continue to go down, I can start loosening up.
Right.
That's a recipe for, you know, canceled games, sick people, all that sort of
Yeah,
stuff.
especially with the variant out there.
And Nate, what I say too is proper masking. You know, I watch them handling their masks up and down. They're using their gaiters, and I say, you know, look at what you're doing. Just wash your hands.
Yep.
Try to keep them up. If you need to hydrate yourself, pull them down.
Yep.
Hydrate, wash your hands. So it's proper masking.
Yep.
And that's what I'm seeing them do more often now, is the appropriate way to wash hands and mask and so forth.
It does look like there's a better masking culture across the country, across our area, Kansas, Missouri included, than there have been. Do you think that's
Yeah.
true?
I think so, at least watching, but I fear, just like you said, Nate, that
Yeah.
the guard's going to go down. When we
Yeah.
hear numbers going down, they're going to say, well, now we're outdoors again. And that's why I stress outdoor sports are safer than indoor, but indoor sports can be just as safe. It's interesting, they used to categorize sports as to high risk, medium, and low. And I used to say, don't do that, because you can take a low risk sport and make it high if you don't do the right things.
Right.
You can take a high risk sport and make it low. So let's not categorize. So now that's a thing of the past.
Yeah.
We're saying all risks, you can be on equal playing field, how to reduce the risk for each of those sports. It can be done.
Yeah, wear a mask, keep your distance, wash
And
your
wash hands, yeah,
Well,
wash
the
hands.
rules of infection control, what do? They travel with you wherever you go, and that keeps us safe. All right, Jess, you're standing in for Jill this morning.
Hi.
Good luck.
morning.
Welcome to the program. Hope all is well.
Thank you. Good to be here. Okay, so play dates and teens gathering can kind of mimic sports and playing sports, being close together. So any thoughts on letting kids get together without fear come March and April when the weather gets better? Can my kids get together for play dates, inside, outside, without masks? What are the
All right.
thoughts?
Ooh, let's back up.
Yep, we
That
just talked.
without mask part, we were doing okay, I think. Small groups, keep kids are always in your circle, wearing a mask, trying to be outside, probably okay. Watch for the variant. Let's make sure the vaccine works against the variant. Some concerns coming out of the South African vaccine, a variant, not so much about the British one, although really important to keep an eye on the South African one, because I think, Nate, there's some evidence, at least with the AstraZeneca
Yeah.
vaccine, it didn't work, and the AZ vaccine got pulled out of the South African market.
Yeah, just this morning I was reading that news. Yeah, it's concerning news because, you know, the hope had been that this AstraZeneca vaccine could be one that could be distributed widely around the world, because it's a lot more stable, you know, higher temperatures,
Yeah.
things like that. And yeah, this 1351, the South African variant, is in fact, yeah, as you said, was pulled from South Africa because it does not show any benefit in terms of
Mild or
symptomatic
moderate
infections.
disease. Now, it didn't comment about severe disease, and I think that's important.
Yeah, the reason they didn't comment about severe disease, deaths, things like that, because they didn't have enough numbers to basically make that comment. And so they're going to continue studying that in hopes that perhaps it would have that effect. And you know, that's obviously very important too. So they may be able to use it if it ends up that it drops deaths.
Yeah.
But there's a concern there, and you know, thankfully, you know, the two vaccines we have licensed through the EUA in the United States, the Pfizer and the Moderna vaccines, they don't have that problem. They may not work quite as well, but they still work quite very well against those variants. But there is that concern with the AstraZeneca vaccine. But again, I think, you know, this has been hit again and again. A vaccine is a tool. It's not the only tool. So, you know, use your masks, keep your distance, because even if you're vaccinated, you can run into these. And there's no doubt these variants are in the U.S. And, you know, I think we've said a number of times, even if we haven't found them yet, they're here too. Just assume they are. Don't assume that, you know, oh, they haven't got here yet, I can throw my mask off. No. Got to be careful, no matter what.
Look like to me too with Pfizer and Moderna, they're able to adjust that vaccine over a 6-week period of time, and really they can make it so that it's going to be working against this. And the FDA, it sounded like to me this weekend, was signaling they were going to let them do that.
Mm-hmm.
They wanted to see a little bit more information, but maybe not have to conduct the trials, which is essentially how we do the flu vaccine all the
Yeah.
time. So I think that's a good step
That's a
for us.
great thing. Yeah, I mean, that's one really exciting thing about these newer types of platforms.
Yeah.
Is that they can be adjusted so quickly. That's a lot harder to do with some of the traditional vaccine models. So, you know, yeah, if we can do that and do it in a safe way, which I think that's what they're showing the FDA, presenting evidence of why it wouldn't affect safety, things like that. That's really exciting because that will allow this to be something that is sort of adjusted on the fly as these new variants come. But
Yep.
less numbers mean less variants, so, you know, all the more reason.
I know. Keep your mask,
preventing.
keep your infection control. So, Dad, what do you think? Are small group gatherings of kids, and you're a family medicine physician, as I recall, by training, is that right?
By training, yes.
Yep.
Yep.
And sports medicine. But are small group gatherings of kids similar to sports?
Well, you could assume that. Depends what they do in those small groups. Same thing, like we say, sports is not just sports. There's different types of sports and different ways that you get together in sports, different ways that you train, different equipment that you use. So that I think you'd have to look at that and say, well, what are you talking about, a birthday party? Or playing pool together, going to a bowling alley and eating out. So those are the things that you have to look at. You know, I think I like your term once that you used, the cows, the COVID weary
Yeah,
syndrome. You know what?
COVID
I worry
syndrome.
more about the cows right now, honestly, than I do about this virus. I think that we can beat this virus, but I worry about cows.
Yeah.
So.
Kyle's is real. COVID weariness
COVID
syndrome.
weariness.
We've all got a little bit of it. I think my wife's especially got COVID weariness syndrome because she's stuck with me on Friday and Saturday nights. And she's like, man, can I get a life here or what?
Carla's daughter is an athlete. Her daughter tested positive on her college campus in October, lost taste and smell in November, and now just last week is starting to have heart issues. Her heart rate has been getting too high. The athletic trainer says that they are concerned because she just had COVID. She had an EKG on Saturday, which looked okay. The doctor's trying to order a 48-hour Holter monitor. Anything else you would suggest?
A lot of specifics to that. And
Yeah, you know, that's
take it more broadly since we don't know.
Yeah, let's look at it the broad way, because I'm glad you brought that up. It's a great question. One of the things that we're being asked a lot about is how do we get our athlete cleared for participation in competition? And so much depends on, are they asymptomatic and positive? Are they symptomatic and positive? Are they really sick and positive? There's actually an algorithm that was published back in the fall by Journal of American Medical Association Cardiology, and we've tweaked it a little bit. I'm not part of that particular algorithm, but I think it's very good. We're not telling everybody that they have to have every test in the world. In fact, our sports cardiologist for KU's, Dr. Tim Beaver, has looked at very carefully the athletes over at KU, and they're in a big study nationwide to try to learn about this. But what we're saying is you have to work with your provider. And one of the recent statements, in fact, it's going to be updated and it'll be out on our Acacia website, is that it's up to the provider and that patient to determine what kind of things need to be done. All providers, physicians, have access to these examples of what should be done. Blood tests like troponin, EKG, echocardiograms, cardiac MRIs. You know, we're learning, at least the unpublished data so far is showing that we don't need to do everything for every positive case. But we need to do some of those things, and we cannot just say, oh, well, you had it positive, you're doing okay, right back to sports. Other thing on that is the graduated return to play. And this is very, very important because some communities have, they say, well, we're just not going to do that. It's a great idea, but we're not going to do it. The graduated return to play shows that if you take someone who has been positive and you can start them out with step one, let them start exercising at a low level, less than 70% of their maximum heart rate, and do that for 15 minutes and see how they feel. They feel good, you can do another day of that, maybe increase the time a little bit. If they get past that, no symptoms, feeling good, then the next step, step 3, would be adding some resistance training, a little higher level, getting up to 80% of maximum heart rate. And again, ask them, how are they feeling? Are they tired, chest pain, dizzy, short of breath, coughing, anything that would be a red flag that we need to back them down and maybe get more testing. The step 4 is when you add much more. Basically, it's full training, full weights, running hard, 80% of maximum heart rate. And if they get through that, asymptomatic, doing well, advance them to step 5. Step 5 is full return to play. So it really goes over the course of 7 days. Step 1 is 2 days, step 2 is 1 day, step 3 is 1 day, step 4 is 2 days, and then step 5 is full return to play.
And that course could be longer if you're not.
Yeah, and you know what? It's not written in stone. It's like the concussion return to play. It's very similar to that. The difference is it's not mandated. You know, the concussion return to play is mandatory. And it has to be cleared by a MD and DO or DO in the state of Kansas. In the state of Kansas right now, we have not said that it has to be an MD or DO. We're allowing, you know, other providers because it's one of those that it has to be done very comprehensively in conjunction with obviously communication, in your case with the athletic trainer at the college, and we take it seriously. It's not enough to say, oh, well, you're fine, go right back out. And keep in mind, detraining happens too. If someone has been off for 10 to 14 days, they detrain significantly. They're going to be tired. They may have more chance of injury because they haven't been working their bodies. So,
Right.
So we are really pushing that graduated return to play. We're really pushing that these people have to be cleared. Some of them don't have providers. We need to find a way to get them a provider so they can be cleared. It's important.
Terry asked, I've heard that you should not take ibuprofen prior to getting the shot. Does that affect how it works?
All right. We probably have to cover this on a pretty regular basis, especially
Yeah.
people like me who like to have ibuprofen before they get a shot, Nate.
Yeah, there is, you know, with some other vaccines, there's some evidence that it may slightly decrease the antibody titer, so the amount of antibody that the body makes. in response to a shot. Not enough to be clinically significant, really small amount. There isn't that sort of evidence with any of the COVID vaccines, but it's a reasonable assumption. Perhaps that could happen, but a very small amount and not enough to be clinically significant. So I would say if it's something that's going to help you be able to take the shot, then you should do it. And the same with if it's acetaminophen or ibuprofen, whichever. I think acetaminophen, probably a little less concern about antibody decrease, but either one is probably just fine. It's just a matter of, is it going to help you to get the shot? Then you should do it, because that's a lot more important than that. Even if there is a little minimal risk, it's so small I wouldn't worry about it.
Kathy wants to know, once I get my second dose, will it be safe for me to visit out-of-town family? Can I fly safely? And can I be around someone who's pregnant?
Oh, there you go. A couple of big questions here, Nate. What do you think?
Well, I guess my response is a question, which is, what is the vaccination status of those people you're talking about, right? So if it's visiting a relative that hasn't been vaccinated, then I wouldn't be confident doing that myself. And the reason, in fact, I've made those choices myself. I would have loved to see my parents. Haven't seen them in a long time. Haven't done it because they're not fully vaccinated yet. And so, the reason for this is that we don't quite know, do these vaccines prevent asymptomatic infection, right? So can somebody that has been fully vaccinated still be infected with the virus, not feel bad, but be able to pass it on to somebody else? I think it's likely that will end up being decreased to some degree, but we don't know that yet. And so, that's the reason I would say, unless the person you're going to visit has been fully vaccinated, that's still a risk. And whether they're pregnant or not, any other conditions you're going to talk about, it's still, are they vaccinated? And that's the risk. You can obviously still mitigate, with masking and things like that. But it's this gets into very sort of personal risk.
What's your risk tolerance? How do you want to do it? What would you say, Dad? What do you think? Would you?
Yeah, of course, I've had to deal with that. I have an elderly mother that I like to see. She says, I'm going to have trouble with loneliness more than I'll have trouble with COVID. But she just got her first vaccine just this past Thursday, and she did very well with it. Very few side effects the next day. Yet, she's got to get her second vaccine. Now, I'm fully vaccinated. I'm 2 weeks from my second vaccine, and that doesn't mean I'm letting my guard down. I'm still going to be careful, and we're going to be careful around my mom. But I think exactly that's going to apply to sports too. When we start getting the level where our young athletes get the vaccination, that doesn't mean that we immediately let the guard down. In fact, that would be my question for you as an expert is, when they get the vaccine, if they have side effects, what about getting back into training? I know, Steve, you had mentioned that you had some pretty good side effects the next day.
Yeah, so I was sick.
You probably didn't feel like exercising the next day.
No, I didn't have to worry about that too much. But this weekend, so I got my vaccine shot on Monday, and then I worked out beginning this weekend. I worked really aggressively on both Saturday and Sunday. So I felt pretty normal today. But toward about 24, 48 hours post-vaccine after that, then I was feeling better, Nate.
Yeah, I guess I would say just let your symptoms guide you, right? So if you're having big fevers, feeling miserable, totally fatigued, then maybe.
Plus, that's a systemic response. You don't really have cellular invasion like you do with SARS-CoV-2. So I think there's less cause to be concerned about that. I do think that, first of all, there's some data that came out, and I don't remember if it was J&J. I thought it was AstraZeneca that showed that it cut the rate of transmission by over 2/3, which is pretty exciting. Because if that's true, that suggests after you've been vaccinated, you can really help. The second thing we have to be very watchful for is the rise of the variant from the B135 one, because that variant looks like it's going to be the dominant form in the U.S. within weeks. And so we have to make sure that the data, the vaccine, now vaccines look like they work against that one, so then we just have to watch for the South African variant. I think after you've been vaccinated twice and it's been 2 weeks, so that's a total of 6 weeks, I think you can begin to think, okay, I'm probably safer. I mean, if we're going to believe the data, we have to believe the data.
Right.
I'm probably safer out in public than I would have been had I not been vaccinated, right? I mean, that's what the data shows. However, remember that if there's any chance you could still spread the virus, the goal of getting vaccinated and aggressive mask wearing is to stop the virus from getting in us, mutating and being spread to others, right? That's really the goal. We want to drop that risk of transmission down below 1. And if we keep it down below 1, then this pandemic will slowly come to an end. What we need to do, I think, is behave responsibly. So once you've been vaccinated twice, are you safer? Yeah, no, you are safer, right? That's the data. You are safer.
Right.
You're much less likely to get seriously ill. That's a good thing. Is it now safe for you to go visit your elderly parents? See, that's a different question. Are you safer? Yes. Are your parents safer? Well, if they've not been vaccinated, I would say to you, that's an honest discussion whether you have with your mom. You say, I can't prove that I'm not going to transmit the virus. And there's a higher likelihood that I'm going to be asymptomatic, so I won't know if I'm sick. So A, still wear your darn mask, and B, make sure your parent wears your mask if you make that choice, and C, have an informed conversation to make sure you want to take that risk with your parents. Now, once your parents are 6 weeks post-vaccination and you're 6 weeks post-vaccination, I think that story gets to be a little bit different.
Yeah.
If you look nationally, Fauci and others are saying you still have to wear a mask, you should still be careful, don't try and do things around each other, but that is over an abundance of caution and making sure that, if you're just with your parents, it's a one-on-one situation. That's different than I'm out in public with my parents because then I'm around other people and I have to be nervous. But if you've had your vaccine, your parents have had your vaccine, you're wearing a mask, I think you're pretty safe at that point.
Yeah, and it's all, it really is just about thinking about who you're around, and once you're, as you said, once you're vaccinated, your risk is way down. The studies say that, and also, by the way, the Israeli data, real world data after really a lot of vaccine is bearing that out as well. So, you're safe, but then...
Yeah, that was good news this weekend, too, about what was going on in Israel.
Yeah.
Mark drop.
Excellent. I mean, it's really impressive. And
Yep.
so that is so reassuring that these vaccines are actually able to do in practice what they have been shown to do in studies.
And can we
That's
just
so
say that
impressive.
the Australians and the New Zealanders have also proven that mask wearing works?
Yes, yeah. I mean, oh, man. Yeah, the response there has been amazing. And I mean, yeah, they're talking, I think in New Zealand, it's something around 60 deaths total. It's just amazing.
It is amazing.
It's so impressive. So, think about who you're around. Think about who could be at risk. And if you can't guarantee, that whoever you're around has been vaccinated, then those people could be at risk. So you got to put that all into your calculation.
The athletes and coaches are asking, though, how long is this going to go? And I say, we don't know.
We don't
What
know.
about summer sport? We don't know. Yeah, we just, right now, let's just keep doing. And that's been the story all
And I think that
along
is
with
the
COVID.
story because
Yeah,
you're
we
not
don't
going
know.
to get all these young people vaccinated for a
Right,
while. So
exactly.
really, I think you're going to look at August, September, October is beginning to feel like we're getting through it, provided that the vaccines continue to work.
Right.
I mean, that's the one caveat to all of this. They've got to keep working. But if they do, I think come fall, things ought to feel a lot better than they do today. I think they're going to feel better this summer. I think we're going to have fans back at the Royal Stadium. I'll be there, in case anybody had any doubt. I think that will allow us then to, hopefully be there as a sea of red when we open up Arrowhead Stadium again.
And that's what the data is showing now, that the rate of infectivity is directly correlated to the rate in the community. So you keep seeing the community go down, and
We
we
should
should
be
see
better
this go
off.
down, but I don't know.
All right.
Adrian wants to know if you can talk about the topic of these end-of-the-day doses. Is there any CDC guidance on giving the remaining leftover doses at the end of the day? I've heard they are thrown out rather than given to someone who is not in the current tier. What's up with that?
Okay, so I can tell you how we handle our end-of-the-day doses. That's
Yeah.
because people don't come, or they come, they don't qualify for some reason, or they were sick actively, or whatever. They don't get, so we have a few extra doses. I will tell you, we were on the phone, like, banshees. I guess banshees can be on the phone. I don't really know, turn of phrase. But we were on the phone in order to try and find someone to take that dose. We have not, I think we've had to throw out a total of 2 doses so far, and those were both because they got made and we didn't think they were going to be, we didn't know that there were extra doses in the refrigerator, and we just didn't know, and that was just a mistake. But I don't think we're
Yeah.
throwing out doses, are we?
No, I mean, I think the guidance is essentially don't throw out doses. Whatever you can do, don't throw out doses.
Just give them to somebody.
Yeah.
Go out in the street. Hey, you want a vaccine? Let's go. We got one right here for you.
Yeah, I mean,
No,
it's
never
the
throw it
story
out.
of the group that got caught in a snowstorm and found other drivers caught in a snowstorm and used those last few doses they had. That's
Yeah.
totally the right thing to do, right?
is.
It's, I mean, I think that's the way to go. Is these vaccines are so valuable. So if you have some at the end of the day,
Give them.
Give 'em.
Give them. It doesn't matter which phase you're in. Just give them. You're in the phase that needs a vaccine right now, and that's just
right.
about everybody.
That's
So,
right.
we've only vaccinated like 3% of the American population. So I think there's plenty of choices out there.
We can find
All you
some.
have to do is find them, call your friends, your relatives, whatever, and just get them up here and get them vaccinated. If anybody runs into a problem at the end of the day, they've got extra doses, they don't have an arm to give them to, go find an arm. Go down to the local McDonald's, get an arm.
You touched on this, but Julie wanted to know, why would you still need a mask when gathering with 4 fully vaccinated individuals? Isn't that sending the wrong message, and could it discourage people getting vaccinated?
Yeah, remember that what we're trying to do, because there's some unknowns here still, and the unknown is how much of a risk is it to spread disease to another person after you've been vaccinated? Vaccines don't stop you from getting infected. I'm going to come back and qualify that in a moment. They stop you from getting seriously infected. Remember the influenza shot. You can still get sick, you just don't get as sick. So the goal of vaccination, although it does appear to prevent serious infection, it may prevent infection overall. I'll turn to Nate here in a minute, make sure I haven't boogered this all up. But the goal of a vaccination is to help prevent you from dying of COVID and to hopefully reduce the rate of transmission. Okay, now we know the answer to the first part. Moderna, Pfizer, J&J, very effective against people dying from COVID. We're not sure about the second part. And so you still wear a mask so you don't transmit it. Because while you're sitting amongst a group of 4 and you've all been vaccinated, sure, you're probably not, none of you are probably going to die from COVID because even if you got it in that setting, because you've all been vaccinated. But when you walk out of that setting, you're going to be around the rest of America, of whom 97% have not been vaccinated. And if you throw out the 10% or 15% of people who've had COVID, you still got a good 80% of America who's susceptible. So you're protecting them from dying of COVID. You can still spread the virus. You just won't be sick. There's some hopeful data that says we don't spread it as much with one vaccine. We don't know the data between Moderna and Pfizer yet. We only know the data, it's AstraZeneca,
Yeah.
that's what it was, that showed a 2/3 rate of decline of spread of the vaccine. We don't know if that's true with Moderna and Pfizer yet.
Yeah. No, I think you're exactly right. Sorry. My instinct is to speak to the person.
I know,
that's speaking.
that's what you're supposed to
Yeah.
do, but you gotta still look at the camera. Otherwise, people just see the side of your head. Well, you have a great profile.
Yeah, beautiful
It is,
That's why they put you in the center, so
Yeah,
you
that's-
automatically.
That ain't my profile, that's what that's for sure.
Jessica says, my 19-year-old football playing son had COVID in the summer and was asymptomatic. Does the heart damage risk still apply?
That is a great question, and you know what? Interestingly, just last week, that case out of University of Florida, Keontae Johnson, that had COVID late summer, recovered from it, playing basketball at a high level, and he collapsed on the court in early December. And there was a big concern that that was what it was. It was myocarditis that had reared its ugly head late in his COVID case. Now they've just proven that that was not his cause of collapse on the court, and that was reviewed by multiple cardiology groups throughout the nation. And so not that one case gives us the answer, but what it tells us is that we still have to be careful. Just like I finished saying, it's very important for that 19-year-old to watch how he feels as he's getting back to his training and competition. He knows what he feels like when he's at a high level ready to play. And if he says, look, I just don't have it, I feel sluggish, whatever, that's a symptom that you report, and someone gets that tested out. Myocarditis is very hard to find. Even with the best cardiac MRI technology, it's a little difficult. And we don't have cardiac MRI capability for everybody. So watch how you're feeling. And that's true of any virus, honestly, any illness, literally. If you are coming back to sports and exercise, if you feel off, what's the reason for that? Get it checked out. It's okay to bring that to the attention of your parents, athletic trainer, physicians, to get an expert to review that. I take it very seriously when I clear someone or talk with someone about going back to sports and exercise. But that's true even if they're not going back to sports and exercise, they're going back to life. So I don't know, what do you guys think on that?
I agree with you. I guess one thing I would say, is at least back when I played football, it was, kind of being tough was sort of part of the mantra, right? And I would say this is a case where you don't get extra points for being tough. If you feel off, get checked out.
Absolutely. It's okay to bring that up to someone's attention. You know what? We also learned, this is a kind of a frightening fact, that some of these young athletes were lying. They were continuing to play their sport, and after the season they said, oh yeah, I was around someone with COVID. I had COVID. I just didn't tell anybody about that. I'm telling athletes, this is a time to be brutally honest. Don't be brutally tough. Bring it up. We're going to help you through it because we want to keep playing sports, right? Yep. That's our end.
You bet.
So.
Jess?
Sharon had a bad reaction with the swine flu vaccine, nerves, muscle numbness. What's your advice on taking the COVID vaccine?
I think it's safe, Nate.
Yeah, I'd say take the COVID vaccine. These are very different vaccines, and of course you're going to want to watch how you feel as you would with any vaccination, but these are very safe vaccines. So
And I had a lot of side effects after the swine vaccine way back, and I also had a lot of side effects from the Shingrix vaccine. And you know what? I'm first in line to get this COVID vaccine. It didn't scare me in the least.
There you go.
So.
Hey, tomorrow, KDHE Secretary Lee Norman is back to answer questions with us about the rollout of vaccines across Kansas. We're delighted to have him back on the program. It's always fun, and we like to mess with Lee. So, Dave, final thoughts for today?
You know, I'm glad to be here, number one, and I'd really hope that what have proven with our experience now through this COVID pandemic and sports and exercise, it's okay to be active, but we still have to be careful. We don't know the answers in the future. We didn't know them back in March, and we've learned a whole lot over the course of a year. And yet, I know that these athletes are happy to be back doing what they want to do. It's good for their physical health, their emotional health, and for the general population. As we all know, exercise is medicine. So it's important to keep the body going. So thank you for letting me be here today.
And we are delighted to have you back, and look forward to having you back on the program again. Nate, final thoughts?
I guess I'll go back to the same thing we've been saying over and over, which is wear masks, keep your distance, don't let down just because you're hearing the numbers are going down. We have a lot of work to do. Things are starting to look a bit better, but we all got to do our part. We all have agency in this.
I like that. We all have agency in this. Well said. Hey, as we close, remember to answer the call to arms when it comes your way. Kathy from Kansas City did. She shares with us a picture about why she got her shot. Remember to send us your video, a picture, and tell us what inspires you to get the vaccine. And we may not have quite run it back all the way, but Kansas City, hey, we had a great year. So let's make sure we follow the rules of infection control. Get your vaccination, because we want to turn Arrowhead red in the fall. We want to have Kaufman blue this summer, and maybe this spring, but really this summer. And we want to make the cauldron roar. We can do that if we do those things. Follow the rules. Get your vaccine. Keep us all safe. We're here tomorrow.
I'm Kathy from Kansas City. I know the worry of having a loved one going through cancer treatment. I got my vaccination to help keep immunocompromised people safe. And go Chiefs!
I'm Cliff, and I'm from Overland Park, and I got this shot for my family, friends, and coworkers.